Understanding urinary incontinence. Urinary incontinence affects millions of people worldwide, but it doesn't have to control your life. Take charge of your bladder health and live a more confident life and be able to control urination. Have you ever experienced an embarrassing moment due to unexpected urine leakage? Do you think you have a weak bladder because you urinate frequently? Do you suffer with an overactive bladder and leak urine? You're not alone. Urinary incontinence affects millions of people worldwide, but it doesn't have to control your life. In this blog post, we'll dive deep into understanding urinary incontinence, its types, causes, symptoms, diagnosis, treatment options, and prevention strategies. By the end, you'll be equipped with the knowledge to take charge of your bladder health and live a more confident life and be able to control urination. Urinary incontinence is the involuntary leakage of urine, which can range from a minor nuisance to a significant disruption in daily life. It occurs when the pelvic floor muscles, responsible for bladder control, weaken or become overactive. This can lead to various types of incontinence, such as stress incontinence, urge incontinence, and overflow incontinence. These issues may result from numerous factors, including age, pregnancy, obesity, and medical conditions like urinary tract infections. Women are more likely to experience urinary incontinence than men, especially as they age. More than 4 in 10 women age 65 and older suffer from urinary incontinence. This indicates that it is a common medical condition among older women. With the right treatment and lifestyle changes, many people can regain control over their bladder and significantly improve their quality of life. Common types of urinary incontinence. There are 3 common types of urinary incontinence: stress incontinence, urge incontinence, and overflow incontinence. There is even a mixed incontinence. That means you have more than one type of incontinence issues. Each type has its own unique set of symptoms and causes. We'll explore these in the following subsections. Stress incontinence. Stress incontinence occurs when weak pelvic muscles allow urine to leak during activities that put pressure on the bladder, such as coughing, sneezing, laughing, or exercising. It is often triggered by pregnancy, childbirth, menopause, obesity, and certain medical conditions that weaken the pelvic floor muscles. To manage stress incontinence, doctors may recommend lifestyle modifications, pelvic floor exercises, Kegels, medications, medical devices, or even surgical treatments. These solutions aim to reduce stress incontinence, strengthen the pelvic floor muscles, and restore bladder control. Urge incontinence. Urge incontinence, also known as overactive bladder, is characterized by a sudden, strong urge to urinate followed by involuntary urine leakage. It is typically caused by damage to the nerves of the bladder, the nervous system, the bladder muscle, or the muscles that control bladder function. Treatments for urge incontinence include lifestyle modifications, pelvic floor exercises, medications, medical devices, and surgery. These interventions aim to regain control over the bladder muscles and reduce the frequency of the sudden urge to urinate. Overflow incontinence. Overflow incontinence occurs when the bladder cannot store as much urine as the body is producing or cannot empty completely, leading to small amounts of urine leakage. Symptoms of overflow incontinence include frequent urination and a constant dripping of urine from the urethra. Treatment options for overflow incontinence include lifestyle changes, medications, and medical devices. These approaches aim to improve bladder function and help the bladder empty more fully. Mixed incontinence. Mixed incontinence is a type of urinary incontinence that combines 2 or more types of incontinence. It occurs when you experience symptoms of both stress and urge incontinence simultaneously, making it difficult to identify the root cause. The bladder is the organ responsible for storing urine until you are ready to empty it. To remain healthy, it is important to maintain a steady flow of urine and void regularly. If the bladder becomes weakened or overactive due to medical conditions such as diabetes or an enlarged prostate, it can cause mixed incontinence. Certain medications, lifestyle changes, and even surgery may be necessary to treat this condition. Signs and symptoms. The signs and symptoms of urinary incontinence vary depending on the type and cause. For stress incontinence, The most common symptom is leaking urine during activities that put pressure on the bladder, such as coughing, sneezing, or laughing. In the case of urge incontinence, the main symptom is a sudden, strong urge to urinate, followed by an involuntary loss of urine. Other signs of urinary incontinence may include leaking urine when you cough, sneeze, or laugh, feeling a sudden, strong urge to pee, and needing to pee more often than usual. Being aware of these symptoms can help you identify the type of incontinence you may be experiencing and seek appropriate treatment. Diagnosis and tests. Diagnosing urinary incontinence typically involves physical exams, gathering your medical history, and keeping track of your bladder activity. Your healthcare provider may use urinalysis, bladder stress tests, pad tests, cystoscopy, urodynamic tests, pelvic exams, and measuring bladder pressures to determine the cause of your incontinence. You may be asked to keep a bladder diary as well. If the initial tests do not provide a clear diagnosis, your healthcare provider may recommend further testing, such as urodynamic testing. This can help identify any issues with bladder function and determine the most suitable treatment plan for your specific type of incontinence. Treatment options. The treatment for urinary incontinence depends on the type and cause. Some possible options are home remedies, pelvic floor exercises, medications, medical devices, and surgery. Home remedies for urinary incontinence include urinary catheters and absorbent pads, which can provide temporary relief and help manage symptoms. Pelvic floor exercises, such as Kegel exercises, can help strengthen the urinary sphincter and pelvic floor muscles, improving bladder control and reducing symptoms of urinary incontinence. Medications and medical devices, such as intermittent catheterization, can also be used to treat urinary incontinence by addressing the underlying cause. In some cases, surgical treatments may be recommended to correct the issue and restore bladder function. Conclusion. In conclusion, urinary incontinence is a common and often treatable condition that affects millions of people worldwide. Understanding the different types of incontinence, their causes and symptoms can help you identify the most suitable treatment options, ranging from home remedies to surgical interventions. By taking control of your bladder health and seeking professional help when needed, you can improve your quality of life and regain the confidence to live life without fear of unexpected urine leakage. Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief.